All right, thank you. That was a great talk, and I think it set a lot of things up for this talk. There will be probably a lot less data in here, but a lot more ideas. But the economics of healthcare, economics of lap liver surgery are going to be important considerations, and a lot of them came up in our discussion yesterday, and I think they should come back up in some way, shape, or form so we can try to understand better how we can close this in terms of the economics. Okay, so what's the future of healthcare? I think this is going to be regardless of where you live around the world. The people who are accounting for healthcare, whether it's the patients or the payers, want to know more of what we're doing. And so these are quotes from different people where they say healthcare will now join process and performance in addition to the science. And I think really what they're getting to is there's got to be a measurable unit of quality. How do we know what you're doing is what you say you can do, and how do you know what everybody else is doing is what you're doing? Which is, again, gets back to Dr. Strasberg's point yesterday about your informed consent reflecting your information, your performance. And the ability for patients to participate is going to be an important determinant of how healthcare is in the future, so we need to inform them. And that's really what economics is about. So just to reiterate what Dr. Abacus just said, dollar cost is not, in fact, economics. Dollar cost is what it is. It tells you what you pay for something. But there's a lot more when you think of what economics is. And I'm going to try to put a little framework of how economists or health payers or even consumers in this era think about the economics, and then come back into what is our responsibility with that. So healthcare economics, this definition or this idea actually started over 40 years ago. And Kenneth Arrow, who defined this term, won a Nobel Prize for it. And it's really concerned with two key issues. It's the scarcity, which is everybody's reality right now around the world, the scarcity of the dollars and the allocation of that to health and health care. And so there are key areas that define why we have a healthcare economic issue that's beyond just cost. And they have to deal with four main factors. And these are extensive government intervention. Mike is socialist. No matter where you are, they're going to be paying for your health care. There's also uncertainty. And I'm going to touch on that uncertainty in a more common term that everybody is aware of in terms of uncertainty. And there's also asymmetric information. This really that's the key point for this group, and I'm going to get back to that, but I'll say it again now. We have to have a way that we can inform whether it's our payers or whether it's our patients, more clearly what we say we're doing is what we're doing. And there's outside factors that seem to affect any decision in healthcare. So a few more details on these to make this more relevant then. Governments, no matter where you are, regulate your healthcare industry. So as Mike even made a point again this morning, why don't we want to change our CPT code? Because we'd be stupid enough to say, no, not unlike the cardiac surgeons several years ago when they're asked, what is the relative difficulty of a coronary bypass procedure? Nothing. It's so routine, it's almost like an appendectomy. What was the response? Drop that down in terms of your DRG payment. And then, of course, there was a backlash after that. We go out there and we say that this is easy and standard and it's much easier for the patients. That's the response they'll get, and that's the fear we have, is because they will regulate it as the major payer. There's the uncertainty. This is the uncertainty, and Mike's last graph shows the uncertainty of that a lot more, the variance that we can't account for, whether it's a bowel perforation or a bile leak that causes you to go out. That's something that makes it hard to model the economics of. And we did our economic analysis in transplant in terms of the drivers of cost and tried to really split it up in two groups, just like Medicare ended up showing. But it's always unclear. You can't predict. The premise of our paper was, can you predict the cost of someone undergoing a